Hello, ladies and gentlemen, and welcome to the podcast. I'm Jessie Bengoa, and today we're here to dig in to a topic that every one of us, whether you're a rider, a groom, a trainer, a tech, a veterinarian, every one of us is in hot pursuit of. It's like the equestrian version of searching for the fountain of youth, and that is how do we build the most durable athletes possible? So, how do we make the critical small moves on the chessboard that result in a winning athlete that stays healthier, more vital, more sound, and thriving with a longer and more successful career? So, there's a surprising amount of crossover in this area with high caliber human athletes. And there are numerous strategies and tools that this group here with me today has both helped develop and put into their own practices on the daily. They're optimizing genetic potential, and they're helping to heal these athletes after injury with the goal, of course, being returning them successfully to work. So let's meet the dream team that is joining me here today, shall we? So first up, meet Dr. Cricket Rosillo. Hi, Dr. Rosillo.
Hi, how are you?
Good. It's great to see you.
And you?
So, Dr. Rosillo, I'll brag on her for just a minute because I can. She earned her veterinary degree at Tufts and has more than 20 years experience as a highly respected equine veterinarian. And she treats top level dressage horses and show jumpers in particular up and down the East Coast and in Wellington, Florida during the season. Cricket was also the U.S. equestrian team veterinarian for 3 years, during which she became a certified member of ISELP, or the International Society for Equine Locomotor Pathology. Rolls right off the tongue. And ISELP is a big deal in our industry and in equine lameness and sports medicine in particular. And Cricket, did you do your internship at Texas A&M?
That's correct. I did a year in their large animal rotating internship.
Okay, awesome. Well, I'm partial. I'm an Aggie. Gig 'em.
Ah,
So next up, I want you to meet Dr. Erin Contino. And Dr. Contino is a lifelong equestrian in her own right, a 3-day eventing rider specifically. And she hails from Northern California originally, but she earned her veterinary degree at Colorado State University, followed by a board certification in equine sports medicine and rehab, and a fellowship in equine musculoskeletal ultrasound. And she's currently a researcher and an associate professor there at CSU and focuses heavily on lameness and poor performance. Hi, Dr. Contino. Welcome.
Hi, thanks so much for having me.
Oh, it is entirely my pleasure. And now, the man that most of our listeners know well, and that's Dr. Matt Durham. Dr. Durham is a renowned equine veterinarian, and he treats top tier sport horses as well and has for 20 years, right around California's Greater Bay Area. And all the while, Dr. Durham was a platinum client as well. And several years back, we were fortunate enough for him to join our team as a senior veterinarian, where he now spends all of his time educating throughout the industry as he always has. He's so amazing at. And I'm happy to have him here today. And, like Dr. Contino, he is also board certified in equine sports medicine and rehabilitation. So, hello, Dr. Durham. Welcome back.
Hi, Jesse. Thanks.
So, now that you've all met the group that's going to show us the light today, let's jump right in. So, how do we build a more durable athlete when longevity is the goal? And I'm going to turn to Dr. Rosillo first. So, Dr. Rosillo, if you would give us kind of a lay of the land. So, not only has sports medicine and what we know about lameness evolved dramatically over the last few decades alone, but I think we all recognize that the quality and the caliber of the horses in the show pen has evolved too. So their schedules are busier, they're traveling more, stakes are higher, and the competition is pretty fierce. So talk to us about that and how you're guiding these horses with proactive exams and deploying these preventive strategies that keep them active and successful for longer.
Well, I think you're exactly right. The schedule has sort of forced our hand to change our approach. The time off that the horses might have seen in the winter months, for example, is just no longer there. and you could pretty much take your horse to a competition year round. And so my approach has definitely focused on the preventative exam, looking at these horses routinely, trying to get a sense of their baseline, normal, understand where their weaknesses lie, and stay ahead of the curve. And then not just thinking about musculoskeletal health, but also incorporating aspects of diet, podiatry, incorporating the other team members like the farriers and the physiotherapists, because it takes a whole team to keep these horses at the top.
I love that, and I promise that I didn't share my questions ahead of time, but she just pretty much ran down the list, so good job. Um, but, with these horses that you treat, are you seeing them more often, but treating them less often because of this approach?
I agree with that. I certainly am looking at them more often. One of the bigger aspects of my personal care plan is the recheck exam. So I'm not just looking at them when there's a problem, but after I've treated for that issue, I really try to get my hands on them, eyes on them one more time and say, okay, was that good enough? And now how, for example, does treating their hocks make their back feel? Is the horse moving better overall? Are there any other fine-tuning aspects of comfort that I want to now incorporate? And I'd rather look at them more often and say, "Hey, they look great," than space those exams out too far and miss something. And along that monitoring plan, I may have horses that aren't necessarily in my zip code, but we've incorporated the Sleep app for gait motion and have found that to be a really productive tool to keep a beat on how these horses are doing even when I'm not next to them. So I can share the app access to the groom or the rider, and we can record some straight line trials and keep tabs on something. For example, a horse that's recovering from an injury and really phasing back into work, or a horse that we know has a malady that we don't want to get away from us and feel comfortable going back to the ring.
Yeah, I love that. I mean, there's so much more technology that's out there now that can really help. But I love how practitioners like you, I always hear you all talk about the fundamentals too, and coaching your clients on the importance of establishing the baseline and then those rechecks. And it's funny, I think as writers, we can sometimes think, oh my God, that sounds expensive. But in reality, I remember Dr. Herthel always used to say it's actually the most economical thing you can do is the preventive. Because once there's a fire, it's both difficult to put out correctly and with success, and it can be a lot more expensive at that point. So, I love what you say there. And Dr. Durham, I want to turn to you next because I feel like a critical factor in determining success with these athletes is really understanding, kind of as Cricket just mentioned, the role and importance of the axial skeleton and the top line in particular. So essentially, a horse's core strength, we hear that as huge all the time. And you're a big believer in a few things. Number one, that the core should come first, and you should be building proper muscle before, like those task or discipline specific conditioning methods. And two, that more work isn't necessarily the answer to proper muscle and even cardiovascular fitness. More isn't always more.
Absolutely. Yeah. I mean, I think we traditionally had always sort of focused on the limbs for unsoundness, and we still need to. Obviously, there's a lot that goes on in terms of arthritis, tendon injuries, and that sort of thing. But what ties it all together, what moves the horse around, is that core. And so, as you mentioned, I think one of the ways that we can have an influence on that is in early development of horses. I think it's common for, say, a big warm blood bred for jumping, and it's this big baby, right? And I think we need to consider that it's like a high school athlete, college athlete, professional athlete. There are these tiers that, is that high school athlete a great athlete? Yeah, at that level. But if you tried to put that person in at a higher level, they wouldn't be able to do the task really. And so one of the things that for me is really important is developing that core strength. And I've seen numerous, in particular with jumpers, where their their ability to propel themselves over a fence and then land in a way that is safe is altered by their core. And that makes them more vulnerable to injuries. They're just not going to be as good at their job. So I think one of the things that a lot of people that aren't in other disciplines, when you talk about dressage, they just think of white coats and maybe sometimes, uh, certain carriages and things like that. But the fundamentals of dressage should apply to every horse, in my opinion, because that's about developing the core, developing balance and proprioception. And in order for an athlete to be able to perform well, they need they need to know where their body is in space. This has been shown, really well by uh, core stability exercises, increasing those muscles that we can't even see or feel. That creates a situation where you're less likely to get injured. You're more likely to come back to work after an injury. And so for me, that core is just so fundamental on before that horse is even an athlete. And you mentioned this sort of um, general versus task specific training. I think, if you think about kids, say someone who's becomes a professional basketball player. As a kid, they might have played soccer and baseball and run around in the hills and done these weird things, right? Is that going to help the professional athlete later on to play ice hockey? Probably not. Serena Williams isn't going to develop her swing. She has to incrementally develop that through task specific exercises. But for the young developing athlete, it's more about those fundamental exercises in developing resilience and balance and ability to handle all sorts of these other tasks so that as they develop as athletes, then they're more resilient. They're able to handle those tasks. And then in terms of the treatment side of things, I think uh, when I first learned about back pain, it was always back pain will go away if you inject the hocks, and a lot of times it will. But I had my own lesson in the difference between primary and back pain in that I injured a disc. And that primary pain was just excruciating. They thought I had a heart attack. I turned gray, green, fell on the ground. The interesting thing is that later, the dominant pain was not in the disc, but in the muscles, in the support muscles, because of the way I was hunched over and posturing. I was overusing certain muscles. That was in that moment, my primary pain, the thing that I perceived the most. And I think that was a great lesson for me because a lot of times we have ways that we can ask a horse where they're hurting. And maybe what's hurting the most is sort of on the surface. A lot of times it is muscle. And to me, that might be a secondary pain, and that sometimes we need to look deeper. Certainly in the back, uh, people talk about kissing spines all the time. It's a real problem, but it's also overdiagnosed, in my opinion, in terms of what's the fundamental problem, because there are all sorts of joints between spinal segments as well as the muscles as well as the discs that we don't really talk about, in particular at the junction between the pelvis and the lower back. That area is really vulnerable, and I think for me, the top line, the more I dig into it, the more excited I am about it, and then the dumber I feel because there's so many layers and there's so many interactions. But ultimately, a horse, including the neck too, right? Of course, neck all the way through the sacrum. If that's not functioning right, then the athlete isn't functioning right. I better stop talking. I'm going to take up the whole time.
I love it. And I've heard you reference our good friend and kind of prolific and celebrity trainer, Peter Park. I've heard you reference him kind of in the topic. And I remember the story that Peter told where he's a human trainer. And he had this, I think he was a dirt bike rider, like a really high level young dirt bike rider. And he kept getting injured and injured and injured. And nobody could figure it out because this kid is young, he's top of his game. Why is he getting hurt all the time? And he came to see Peter. And Peter said, well, it's because your core, frankly, sucks. You know, like you've got to focus on core strength. And so he wouldn't let him do any of these task specific workouts anymore until he built his core up and then the injury stopped. And so it's just an interesting thing that I think translates really well over to horses. 100%. So I want to switch over to Dr. Contino real quick because I don't think many would debate that riders today are more and more in tune with their horses than ever before. So talk to us about the instances when a horse is in front of you, not presenting with an obvious lameness, but the complaint from the rider is a little bit more vague. It's simply, I guess, or complexly rather, poor performance. This horse is just not performing like they usually do. Something is off, and I'm not sure what. And you've done a lot of work and research in this area. So what are you looking for? What does that look like, that process? Because there's so many possibilities, I'm sure, that are going through your head from muscle to airway and everything in between. So how are you tackling these cases?
Yeah, I feel like this is the space where I live. These horses present for that exactly what you're describing, this vague, poor performance. And the first question, I think, and immediately doesn't come to mind as often as it should, but I think we have to recognize that not all human athletes go to the NBA, right? Like there is a limit to what a horse's natural ability is. And I think I might be too slow to have that enter my mind because we're all like type A driven on wanting an answer, right? Like that's why they're there. You want this horse to be able to perform at its utmost ability. You want that for the rider. You want it for, the whole team. So I do think that it's a hard conversation, but it's something that I need to get better about asking myself, have we asked more of the horse and is it physically capable of doing these things that we are asking it to do? But before we get to the point of saying, you know what, I think that this really is, we've maxed out this level, then it gets more directly at your question, which is how do we work through that? I am surprised at how often it is still coming from something musculoskeletal, but it maybe isn't as obvious as what we think it should be or that we were trained to see. So it doesn't present like an overt lameness, but I will still very much rely on my thorough musculoskeletal exam that also includes functional things. So a lot of the things that Dr. Durham was touching on where we're assessing that horse's functionality of its axial skeleton will give us a lot of hints potentially of how it's been compensating or how it's using certain body parts or not using certain body parts correctly. But, and I will watch them go. And if they're not overtly lame, depending on, there's lots of things in the history that might tip me off as to which direction I'm going to go because it could be musculoskeletal. It could be more primary muscular as opposed to primary lameness. It could be GI related. It could be cardiovascular. It could be respiratory. It could be hormonal. I mean, and that's only a partial list, but that's still like all of those things are going to take me weeks to work through. So I definitely start with a musculoskeletal exam. And if I see an overt lameness, that becomes a little bit easier. It's our comfort zone, right? We know how to work up lameness. And so we would go forward with that. But really what you're asking is what happens when we don't see overt lameness? And if the history points me to a couple of things, more behavioral type of things that are different for that horse in the face of everything else having remained the same, then I often will still do some blocking to see if I can change the horse, because that's really what I'm looking to do. If they come to me for being fussy in their contact and I block their front feet and the rider rides them again and they're not fussy in the contact, it helps me make that connection to say, well, even though the horse isn't overtly lame on its front end, when I get rid of its foot pain, it behaves differently. So that's probably how I start these cases. And then based on all of those other systems that we talked about, a lot of that again goes back to the history. Is it more that they're having a difficulty recovering? Are they sort of petering out partway through cross country? Those things might tip me more towards looking at respiratory cardiovascular before I might look at the muscle system. And in all honesty, I think we look at all these systems all of the time in a lot of these horses because so many times it's not just one of these problems, it's multiple issues. But I do think that there's a lot of value in listening to what the riders are telling us. They are more in tune with their horses than they probably ever have been, and they see them every day. I only get to see them intermittently, so I heavily rely on what they're telling me, and then it really is those little pieces in the history that are going to help me basically prioritize which systems we're going to look at. But my overarching approach is that, and it's probably a biased proportion of horses, right? Because if the primary vet is suspecting it's musculoskeletal, they're going to come to me. And if they're suspecting it's respiratory, they're probably going to go to someone who does more dynamic endoscopy than me. But that is definitely how I rank those systems as I start working through those cases.
No, I love that, and I feel like knowledge has evolved so much in veterinary medicine over, just the last couple decades alone. We know so much more about the importance of the top line, and we know so much more about the cervical spine, and we know so much more about the back that I guess it's almost a blessing and a curse that there's so much to consider, and then all of this new knowledge that we have that it could go left or right at any given moment. So thank you for that. And Dr. Russillo, I'm going to come to you next. How are you coaching your clients on the right way to handle these cases in terms of the goal is long-term soundness and career longevity versus shoring these horses up to get them just sound enough for the next show and the next show? So are you seeing them more often as well? And what preventive maintenance are you deploying? I mean, you work on horses where they could be hitting their peak at 14, 15, even older. So how do you approach these cases for longevity? Because you're working on some pretty high-level horses.
Well, I think you have to meet your clients halfway. There's going to be moments where the horse has to get back in the ring. They're chasing World Cup points, or the syndicate owners are in town and the horse needs to be in the ring, right? So in those moments, you have to find a way to help the horse feel comfortable to have a little bit more, endurance and get back into the ring. But I find myself saying to clients, okay, this is what I see coming, and let's look at the schedule. And so even though maybe it's proactive, even just looking at the schedule, when I was team vet, we would sit with the schedule and, like, say you have a horse that doesn't feel super great after the farrier comes. So let's figure out where we want the farrier to come relative to the outing that is planned, in the middle of Wellington for the CDIW, for example. So really being proactive about how these other aspects of the horse's care fall into your program can be beneficial. And you might be watching the horse on a weekly trot up, just say, yeah, that looks fine, back's feeling good, your trouble spots you're monitoring, but you start to see the changes. And again, you go back to the calendar and say, I really think we're going to need to repeat cervical facet injection therapy. That for me is something I want a little bit more time off around, and before they're going to be pushed again. So where does that fit in our calendar? I really don't like to work on a calendar and say, like, we kind of have a joke, like, I don't predict therapies on a 6-month basis. I don't know where that ever got created, but somehow you have to sometimes reverse some clients' thinking, and they'll say, well, we did this hawk 6 months ago. Isn't it time to do it again? And I try and stay off of that. But I do think you have to look at the calendar to inform you about, competition, peaking, strategies about where you need to be in that way. And then over the course of the horse's career as they age, sort of piggybacking on something that Dr. Durham mentioned, you have to be thinking about, I've got a young horse versus an old horse and how their needs are going to change. and working in on the concept of, okay, now we might have an endocrinopathy that's poking its head into our horse's general makeup, and that's going to switch my strategy. I need to be thinking about some endocrine blood work. I need to change some feeding aspects to support this horse, or mix in another medication in order to avoid some collagen degradation because it's an older horse now with an endocrinopathy. There's It's a moving target, but working with your client and helping them understand what you're trying to get to, and being willing to maybe put a patch on there at some point because it has to go to the ring in a sooner time frame in exchange for an opportunity to slow that horse down and give it some TLC.
I love that. I mean, it makes perfect sense, right? You're balancing goals with reality because there is a reality to the horse business for sure. And Dr. Durham's over there wildly shaking his head in agreement. Where, I mean, I heard you say that you are not a fan of calendaring, and I've heard him say this umpteen times that it really is it's not a cookbook, right? It's not the same recipe for every horse. It's not the same timing. It's needs based on the individual case. And so I love that. And I also love how you're talking about managing the horses. And actually, Dr. Durham and I were talking last week about a sponsored rider of ours, Haley Kinsel, who is a 4-time world champion barrel racer. And this girl is all business. I mean, the way that she handles her most famous horse, Sister, is so admirable. I mean, everybody wants to see her riding that little Palomino rocket into the arena. That's why they come. They want to see Sister and Haley do their thing. But Haley is so protective over that horse, and she'll look at the rodeo schedule, and Sister is only trailered out to very specific events and then brought home and laid off for 2 months just to let her recover, because longevity is what she wants out of that horse. And so I love that when athletes take that into mind, and when veterinarians are really making sure they educate on that. Um, so I want to also ask you, and Dr. Rosillo, I'll come back to you first with this. We live in the world of advanced nutrition, right? And the role that that plays in helping to maintain these athletes and hopefully support a career with longevity to it. How do you use that in your practice and with the athletes that you serve?
I think nutrition has been maybe the most recent lever that we can really pull, through some of the advancements, like with what Platinum Performance is putting on the market. You can identify, oh, this is a horse whose back gets really sore because of a glycogen depletion, and I can add the Platinum Renew. And when I'm trying to go out 2-3 times in 1 week with this one horse to compete, it's going to be able to recover and perform better day in, day out. I don't think that was as easily supplied, when I first started in this business. And so some of the focused nutritional supplements have really made a difference for specific horses, or, horses with myopathies, now that we understand how to supplement them differently. I mentioned already the glycemia, well, excuse me, not, insulinemia issues that we struggle with some of the endocrinopathic horses, which for sure in my dressage clients, I'm seeing, you mentioned before, like these are older horses, so we have to feed them differently. So having more stable sources of, caloric density that, in a bite for bite, they can get what they need and really bloom is so important. It's not just a grain mixture anymore, really. It's more about good forage, a balancer, and these targeted formulas to help different aspects of their systems recover.
Yeah, I love that. Dr. Contino, how about you?
I think just adding on to that, when I grew up in Pony Club and we had to like talk about in our testings the different nutritional categories, and we sort of learned the general concept of being able to load calories but stay within that 1.5 to 2% of what a horse is actually able to intake a day. And so there's been a huge amount of advancement, both in what we know and I think awareness on veterinarians and an owner's part about better ways to do that. So a very simple example is, we used to just think, oh, if you just add corn oil, it gives you that caloric dense, I know, don't, I see her twitching.
I did it too.
Caloric dense source of of fat, but we know now so much more about the inflammatory profile that comes with it. So it's finding ways and understanding that things like the microbiome play a role in the inflammatory load that the horse has. And so there are ways, and this ties really into the endocrinopathy thing as well, because we're more limited in how we can treat some of those horses without being able to use corticosteroids, that we do have to think about other ways that we can try to target anti-inflammatory management. And some of that is going to be as simple as weight loss, in addition to some of these more targeted diets that we can give them. And then we're also understanding a lot more about going back to kissing spine, right? Which is, I totally agree, overdiagnosed. It's very common, but still overdiagnosed, and the clinical relevance of it and how much it ties to ulcers. And so it really is like, the more that we learn, I feel like our Venn diagram starts to overlap more and more and more. And it's all very much interrelated. We've come a long way from just adding corn oil to the diet. So
Well, and it's not a good discussion unless somebody mentions a Venn diagram. So I love that. Thank you.
Right.
Dr. Durham, how about you? I mean, you work on this topic just a little bit.
Yeah, I mean, I think one of the topics for me, um, I feel like when we used to talk about nutrition, it was just about caloric requirements and then ticking all the boxes of mineral and protein and this sort of thing, and more thinking of it as fuel. And we still need to think of it as fuel. Horses need a lot of it. Um, but there are a couple important things, I think. One is that most of the fuel that a horse uses comes from the hindgut. It's not from the sugars that are absorbed in the foregut. 70% roughly for a horse that's eating forage comes from the hindgut. And one of the things that Dr. Contino mentioned is with dysbiosis, the effects on the immune system are really critical, but also the effects on the ability to digest. So one of the things that is talked a lot about in, cattle and things like that is feed efficiency, which is really typically more how many dollars does it take to get a gallon of milk, say. But in horses, I think we should be considering that as well, because we know that generally speaking, if they can be on forage alone, they're going to do better. Now, that becomes easy if it's a horse that's not doing a lot. It becomes a lot more challenging when the horse is under a heavier athletic demand. So, one of the levers that we can push is to improve feed efficiency. And we know that we can do that through supporting the microbiome, which is really kind of amazing. But for me, one of the key things in terms of our discussion today is longevity, not just athletic longevity, but longevity. I liked going out to treat that 32-year-old retired horse who, was just somebody's buddy, but still getting along and kind of the boss of the herd, maybe. Uh, I think when you talk about what an old horse is, and you look at the literature, a lot of times they're talking about 16, a horse that's over 16. Well, we know a lot of athletes are really in their prime at that level and beyond. And we've been able to do a lot of that through being proactive, choosing our therapies wisely. But I think one of the big things is, in human medicine, it sounds really gimmicky, but this inflammaging idea, right? And a big part of that is actually oxidative stress. So we know that free radicals cause a lot of problems throughout the body. Free radicals attack fats. So think of the outer layer of every cell in your body, proteins, all the structural parts of the body, signaling molecules, all this, as well as DNA. So we know that free radicals wreak havoc. The body has a lot of systems that are in place to deal with this innately, but they rely on proper mineral levels like zinc, copper. Another one of my favorites, selenium. Selenium has this really sort of narrow range where if you have too little, you're not thriving. If you have too much, you're not thriving. And uh, that for me is really important for hoof quality, for the immune system, for actually for thyroid hormones to function properly. The correct amount of selenium is essential. So there are so many of these things that we can do that um, take horses from just being alive to thriving. And certainly with athletes, that's what we really want to try to do. So often, I heard a great lecture on racehorses where he said, "We'd love to think that the best racehorses are just they just have this amazing genetics. Their heart's bigger. They're all of these things." But ultimately, what he said was that at that level, and I think this is true in most of the disciplines, right? They're all extremely talented athletes. What it takes is to not fall down from that in any one category, right? A little muscle stiffness here, a little foot soreness there, a little even just mechanical problems with the way a horse is shod. But so much of that can come nutritionally in terms of just supporting all of those systems. Can we make me an NBA player through nutrition? No. But can we make me thrive to the point where, hopefully I live a little longer and a little healthier? Absolutely. So I think it can apply to at any level, but when you're talking about these extremely talented athletes, we want to just make sure that they're able to live up to their potential in any way possible. And nutritionally, I think there are a lot of subtle things that can be done that can support that really well.
Well, I'm very sorry that your NBA dreams have fizzled.
I know,
But
I know.
keep your day job. You're pretty good.
Dr. Contino just ruined it for me, but I guess, yeah.
I love it. Okay, so I've heard you all mention a couple pieces to the puzzle, right? I mean, this is a multifactorial thing that we're talking about. There's no one magic lever that we can pull. There's quite a few that kind of work in concert with one another. So, one of the things you mentioned is podiatry, hoof health, farriery, and the importance of that. So, Dr. Contino, you all actually have an incredible podiatry program there at CSU, led by the amazing Dr. Luke Bass. So, talk to me briefly about why podiatry and hoof care and farriery are such key pieces to that puzzle and how riders can kind of use that intersection between their veterinarian and their farrier to make sure they're finding success there and that piece of the puzzle you can be confident is taken care of.
Yeah. I think there's a few key pieces of that question and things that I want to make sure to mention. So we do have a podiatry service here at CSU, and it is, I think, really, really important to make sure that you build a team. And so our podiatrist is often taking is more it's almost thinking of it like rehab, like in the same instance that you might send your horse to a professional rehabilitation program, you might be thinking about sending it to the podiatrist. But really, when we go into long-term management of these horses, it is getting that horse's regular farrier to be on board with the game plan and making sure that they have say. So oftentimes it's not even just a relationship between us and the podiatrist, it's us, the podiatrist, and the farrier, so an additional farrier, because they're really the ones that are going to have to manage it. That means that we have to come up with some sort of program or shoeing setup that not only works for the horse, but that is reproducible down the road. That may mean that we are taking them from more of a specialty setup in the rehabilitation or more the acute phases of whatever it is that we're dealing with, and then transitioning them over time into something that farrier can do more practically, or bringing them in to teach them how to do whatever it is that that particular horse needs. I know we started the conversation, and I totally agree what a huge piece the core and the axial skeleton is. But the other thing that we sort of, the old adage, right? There's no foot and there's no horse. And that is absolutely true. I always am fascinated by this sort of kindergarten fact that horses are running on the equivalent of our middle fingernail. Like that just is mind blowing to me, especially when we look at what they're capable of doing. And so it makes very good sense that if we have our middle fingernail as strong and as balanced as we can make it, we're going to be setting that horse up for success. It also ties into core strength in that we know how much those little proprioceptive things, often things that we can't even see to the naked eye, are influencing that horse's tendency to get injured. And I think shoeing and farriery falls into that same exact category. If we don't have them landing balanced, we are absolutely, just by repetitiveness, going to be setting them up for biomechanical stresses that the body either isn't adapt to deal with if those sudden changes have come on suddenly, or again, just because of repetition, we're going to be setting them up for something to fail in that system. I think that there's probably other things that I failed to mention in answering that question that will come to me in the midst of something else, but those are my initial thoughts on your question.
Well, feel free to pipe up then. But no, everything you said makes perfect sense. And Dr. Durham's over there shaking his head. He actually went to farriery school before veterinary school. So he's got a very special connection to this topic. And I feel like today, I mean, the topic of how to build a more durable athlete could not be any bigger, right? I mean, we could be here for 8 hours easily. But if you do want to hear anything more in depth, there are quite a few podcast episodes we've done with Dr. Durham and some of our farrier partners on deeper topics there. And also, we keep talking about core strength in the top line. I got to have a fascinating discussion with Dr. Contino's colleague at CSU, Dr. Melissa King, who lives in the top line pretty much all day, every day. So you can check that out too. And Dr. Durham, I want to turn to you again for just a minute because as we've been talking, there's been a few subjects that have come up, one of which was podiatry and farriery. The other, I feel like, has been endocrine disorders, aging horses, horses with metabolic issues. And I feel like we talk a lot about sports medicine, we talk a lot about lameness, and it's still perhaps not as appreciated as it should be, the role that metabolic health plays in determining career longevity. And not just overall health for these athletes, but also the effect that metabolic dysregulation can have on their soft tissue, even. I mean, tendons and ligaments. What say you?
Well, yeah, I think we've concentrated correctly on the idea that certain horses have poor responses to glucose, and that causes spikes in insulin, which then increase the risk for laminitis. So we sort of get this glucose, insulin, laminitis thing imprinted in our brains as the entirety of the problem, when in reality, that's the worst case scenario. That's the outcome, and it's something that we have more influence on than certain other parts. But ultimately, if we break that down and not be as specific as insulin dysregulation, but talk about metabolic syndrome, I think even though that's sort of a squishy term, what does that really mean? I think it's important because it encompasses so much more than that. And it gets back to that um, the idea that horses with metabolic syndrome are more likely to have ongoing inflammation, oxidation. Michelle Coleman's shown, links from with obesity and asthma. This to me, I think, is something more insidious. It doesn't, laminitis is in your face. It's scary. And I mean, horses die from it. And literally 90+%, probably 95% of laminitis cases are caused by that, the glucose insulin laminitis train. But if you're talking about metabolic syndrome, then we're talking more about all the other things that are going on, including that baseline increased oxidative stress, which is sort of both an underlying cause, likely, of metabolic syndrome and certain other things, but also a continuing background. So if you have oxidative stress and inflammatory stress in joints, in the hoof, anywhere in the body, right, you're not thriving. And this, we've probably all seen some horses who, the dressage horse with the hind suspensory injury that is, suddenly moved into the stall. And I've had a lot of those where they just don't heal the way they should. Everything's going well. Maybe they're even at a rehab facility and of course, some horses don't all heal the same way, but metabolic disease can certainly play a role. Uh, Reproductive health, we know, is affected by it as well. And one of the things that we talk about in humans more is the sort of visceral fat, and how fat we used to just think of as a storage thing, really, but it's actually a functional organ. It produces a lot of bioactive chemicals, right, that signal to the body all sorts of different things. And uh, one of the things with metabolic syndrome is that visceral fat and the stuff on the crest and all that uh, is amplified, and that is more sort of problematic. And one of the things that I think we see in particular in the judged equine events, dressage, hunters, cutting horses, is that their paradigm of what a 5 should be, which, on the Henneke body condition scoring scale, a 5 is where there's just the right amount of fat. It's healthy, but in those disciplines, those judge disciplines, that gets pushed towards the 7, 7.5 sometimes. I had a dressage trainer, professional, who said, "Look at how we've developed the top line over his neck. It's incredible." That was developed in the feed trough. There's no muscle above the nuchal ligament. And I think we're not necessarily doing those horses a favor by sort of turning a blind eye to what judging has done to those disciplines, in my opinion. If you look at professional football players, college players, they've looked at the association between uh, body mass index and I almost said equine metabolic syndrome, just metabolic syndrome,
We're just
and diabetes.
if we're being
Yeah.
careful with the size of
If
horse.
they develop equine metabolic syndrome, things have really gone wrong. But it's not shocking that the linemen, who are 300 pounds, more fit than I am, right? They're running, they can jump up on a 30-inch table, they can knock you around. When they're fit and active, because that's one of the big things with metabolic syndrome is exercise. They've shown this in ponies where even before they lose weight, the insulin responsiveness benefits just by exercising. So now you take that dressage horse with a BCS of 7 plus, and with the hind suspensory injury, which probably carrying around an extra whole lot of weight doesn't help. Then you park it in a stall for a while. And of course, that's not proper rehab. I'm just using that as an example. But uh, as that horse is now not in full work, hopefully they've adjusted the diet. But that a lot of those horses that are sort of teetering on the edge of metabolic syndrome can really go over that edge pretty easily. And I think it can be really tricky to manage those. And a big part of it is not just the uh, insulin laminitis link. We need to have that in mind, but I think there are a lot of layers that we sort of overlook. And anyway, yeah.
Yeah. Dr.
I just wanted to add to that. I think we also have to realize that all of this stuff is a continuum, and specifically to laminitis, it's easy for people to look at a radiograph and see if that foot has rotated. And I think we get sometimes too strictly adhered to that definition of laminitis when really there's a huge range, I think, on this sort of bell curve or spectrum where you can get subclinical laminitis that's probably absolutely tied to this insulin regulation or dysregulation. And I think it plays a pretty big role that it may not be full-blown laminitis, but even some of those horses that just have a tendency to get a little bit sore after shoeing, that may prompt us to want to do something that's a little bit more specific for endocrine testing, right? That might be enough. If they tested normally, I might go do a high dose or oral sugar test because they shouldn't be getting sore following routine shoeing, or at least something to check off the list. So just wanted to sort of mention that idea that I think a lot of times they can have subclinical laminitis. It's a lot harder to see radiographically, but you would pick it up using something like a PET CT, or just if you're really analyzing those radiographs a little bit more critically.
100%. I mean, everything you just said is incredible because laminitis does most of the time, when you're talking about endocrinopathic laminitis, it does behave in a subclinical way where you're not even seeing signs so much of the time, but there's this inflammatory cascade that's building and building and building because of all of these things going on with the horse's management or, everything that Dr. Durham just talked about. And I think as riders, we particularly have to pay attention to that, where it's like, if we are not being an advocate for our horse and doing what needs to be done in terms of diet and kind of having the hard conversation with ourselves with weight with the horse, then we are setting them up to be at a greater risk for laminitis, which all it does is take a trigger if that landscape is already laid. So it's a scary thing to think about, but there is so much we can do if we think about it that way, and there's a lot of preventive maintenance that can take place with these horses. So, Dr. Russillo, along those same lines, you do treat a lot of dressage horses, see a lot of dressage horses, see a lot of English sport horses in general. I feel like the tough conversations do lay with veterinarians a lot of the time where the owner's like, and look at this specimen, gosh, it's gorgeous. And you're like, yes, it is, but it's very overweight. Let's have this talk, and I'm sure that that's real comfortable. But talk to me about that because you do live in this world every single day.
It's a really hard conversation to structure because the clients want to feed them lots of treats. They want to, they show their love through sugar. I mean, how many people have walked into a dressage arena and sitting there by the entry next to the whips and, a lunge line is a treat jar full of sugar. And getting off of that is sometimes an impossible task. A little bit like Dr. Contino is saying, this screening for endocrinopathies, I think, is a really key aspect of the longevity of any horse. And it is part of something that I do sort of now in any one of my new client evaluation, new patient evaluation, sort of regardless of age, is to start and track what their response is. If they're over age 12, then maybe I'm going to do a TRH stim. And if they're under age 12, I'm at least going to pull an adiponectin and start using the insulin. And some of the way we assess insulin values is changing too. It's not strictly the fasting insulin. I actually want to know just a random point in time. And that factors into maybe a treatment decision. If I were to consider corticosteroids, would it be even an appropriate choice for that animal? Or do I have an underlying insulin dysregulation that we need to sort of tinker with the diet? And some of these horses, they need to eat. They can't be starving, right? So that's the hard part is the client's going to look at you and they're going to say, well, it's already on, 4 flakes of hay. I'm using a hay nut. But he's got ulcers. There's other factors that we're trying to mesh in here. And you have to think about the boredom issues and the stimulation. And nobody likes to feel like they're hangry. I think we can all relate to that. And very much these horses do too. And if We have to look at the forage sources, and they're in grazing muzzles. I'm lucky to live in Virginia during the summer where it's just beautiful rolling hills. And like right now, the grass outside is so green and so lush, but you just can't let them graze on it endlessly, or we'll have a bigger problem. So we talk about balance of nutrition, kind of going back to what Dr. Durham was saying as well, having some good fuel, feed efficiency. They don't need all these concentrates necessarily, finding a good balancer, meeting out some of the finer details with some other supplement-based support systems, using teff hay instead of maybe an orchard grass or a timothy grass, which as a, different kind of grass, you can feed a bit more of it without maybe having as much impact on their insulin, and just stopping with the sugar cubes as much as possible. Petting, loving on your horse. Maybe I'm not a big fan of some of these other weird treats like sweet potatoes and things like that. I would rather, there are some conventional, like low sugar pumpkin cookies that we've found are good. But it's not easy. And, we want to show our love through food. So we struggle. It's not an easy situation.
It certainly is not, but you all handle it so well. And, Dr. Durham, I want to turn back to you for a minute as we kind of start to round out. So when we're talking about sport horses, Western or English, dealer's choice, nearly every horse in the show pen, I mean, theoretically, and I think you mentioned this earlier, they all have the potential to win, especially at these high levels, right? They have a genetic potential as bred athletes, but there's so much that plays into the long-term success, and we've talked about quite a bit of it today. So, why are some horses more consistent winners? I mean, you look at Kent Farrington and Greya, I mean, at the World Cup just now, McLean Ward and Annie, Laura Graves and Diddy, and I mean, even Nick Dowers and Time for the Diamond. Those are just a few examples of many, many, many. So, what in totality are riders like this taking into consideration with their veterinarians, and what's adding up for these repeatable wins and these longer careers? I mean, it's a combination of a lot of things. We've talked about nutrition, conditioning, farriery, but there's more than that, right? I mean, it goes even more granular down to restorative sleep and muscle recovery and all the things. Talk to me about that.
Yeah, I think you said it, that it's so many different ingredients, and we've talked about a lot of them today. And I think a lot of it, when we're around these professional, you mentioned Haley Kinzel, and I think I was so impressed. She's obviously a tremendous athlete, so already worthy of respect. But when I heard her speak, uh, the the thoughtfulness that she puts into the care of that horse, and in terms of nutrition, in terms of farriery, in terms of exercise, but also thinking about sort of the on-off switch, especially with a very intense sport like barrel racing, where that horse has to be, on sort of rocket fuel when it's time to go, but that's not a sustainable way to live 24 hours. So she has a way of bringing sister sort of like, we're done for the day. And sister knows she can let down and relax. And there have been some really interesting looks at sleep in horses. You know, Horses can sleep standing up, but they don't get REM sleep standing up. And REM sleep, as we know in us, in horses, in any species, is restorative. That's some of the most important sleep. So when you look at a big warm blood in a 10 by 10 stall at a show with the lights on all night and the music playing all night and the braiders all night, and then they're supposed to compete tomorrow, does that make a lot of sense? And so some of it is understanding the horses. Some horses are good at wherever they are, they'll drink, they'll lay down, they can manage that. So there's so much that's horse specific, even beyond the athletic potential. But I really think that what Dr. Russillo said about that team, about the farrier and the veterinarian and the rider and the trainer, maybe not the same person, and physio and all of that coming together with everything for the horse. That the whole point is that we all want the same thing. We all want that horse to thrive and to be at their best. And that's where our egos have to leave the situation so that we can leverage all those other professionals. And I think when you're talking about some of these professionals, so much of it comes down to uh, their understanding of horses and of their behavior and their nutrition. And some of the top riders and trainers are so good with that. They're so in tune. And I think understanding that they can't do it all and they need us, they need their whole team. That's again, I think it gets back to what I was saying about the racehorses. It's ticking all of those boxes so that we're up at the highest level we can be in all of those boxes so that the horse is hitting on all cylinders essentially consistently. And that's going to make them less prone to a lot of the other complications with colics and other issues, that can go along with increased stress and inflammatory and oxidative stress. Uh, all of that together can help a patient thrive and honestly, live a longer, have a longer career and a longer overall life too, probably.
Yeah, absolutely. And I love what you said about sleep. So we had Dr. Christine Fuchs from Germany at Platinum Summit, and her lecture on REM sleep in horses blew my mind. I mean, the entire audience was leaning forward like, "Oh my
Mhm.
gosh." I mean, it's wild. And she came on the podcast. We have an episode where she goes all through it, and there's just so many things that I think a lot of writers don't necessarily take into consideration on the importance of sleep and the injuries that can happen because if horses are deficient in REM sleep, they collapse. I mean, full on standing in a stall and fall over. They're that tired. And it happens a lot more frequently than we would think. So that piece of the puzzle per se was really interesting and I think maybe not totally understood by a lot of people. Dr. Contino, on the heels of that, and as we round out our talk, I want to come to you for a minute and ask, as we continue to improve our approach to building more durable athletes, what's next? Like, how do you see this practice continuing to evolve, and where do you hope more progress is on the horizon?
I think just a couple of maybe closing thoughts that tie into that. One, and this ties into the sleep thing, is I think we are recognizing increasingly, particularly in human athletes, how much emotion plays into their ability to perform. And a couple of examples of that, the US ski team has a phenomenal facility where they train their athletes, and they will do some pre-screening on days that are supposed to be power days, and based on how those athletes perform, that will dictate how much they push that athlete that day. So I would love to get to the point where we could set up some sort of a pre-screen on a day that's supposed to be, I mean, we eventers, right? Like they gallop every 5 days, and maybe on the fifth day their buddy got taken away and they didn't get a good night's sleep. And there's other things that we don't even think about that is going to mean that they're not going to be able to maximize their performance on the day that on our calendar says they are supposed to gallop. And it's tricky because we have all of these other things we have to factor in because they can't gallop tomorrow because they're sore because the farrier is coming and that's already on the calendar and we need to get it worked before we have to do its injections that we have to time because it's competing, in 2 weeks. Like there's so many different pieces of the puzzle, but I think in sort of recognizing the emotional state and how that ties into all of these chronic diseases that we have, and it can go back to, um, in human athletes, when they're looking at it ties into the wearable thing, I think is where I'm going with this, right? We need to establish what is normal for that horse's baseline. And Dr. Rusolo started with this, and so that we know what's abnormal. We know when something changes so that we can pick it up sooner. And I think the wearable technology or things like Slipe are going to help with that. But when they're using this in humans, the other factor besides the wearable is a bit of a subjective analysis. And those athletes, so an NFL player, they don't perform as well if they're just broken up with their girlfriend. I mean, there's all these things that we don't think of as being physical, that we don't think about as being athletic, that hugely influences their ability to perform. And I think we are headed in that direction. And I think that's really exciting of how we can completely manage these athletes and understand that they do better, not only physically when we give them cross training, but mentally they do better when we're giving them cross training. And just trying to educate owners about the value that they can get, maybe by not grinding and sometimes coming at it from a different approach may get us further in the long run.
Yeah. I like everything you just said, and the cross-training thing makes me think of Nick Dowers, who I mentioned earlier, in Time for the Diamond. I mean, this wildly valuable stud, and he goes out in the Western Nevada mountains and gathers cattle on this horse, like, on the regular, and he's like, I mean, I'm building muscle. He's a horse, like, he's out there being a horse, and he's got a great mind because of it, and so I like that idea. I mean, I think that a lot of successful writers have kind of taken that to heart. But Dr. Russillo, how about you? Some closing thoughts, ma'am?
Well, I like what Dr. Contino is offering about the wearables, and I think certainly that science on the human side, predicting recovery and whether this is a push day or a further rest day has certainly is getting factored into the human athletes, and I think we can refine these wearables for horses. It would be really wonderful to know a bit. There's already talk about how to incorporate lactate measurements and making sure your horses are truly as fit as you think they are using these exercise tests, looking at how quickly their heart rate and respiratory rate are recovering, looking at lactate levels and using that in your platform to assess if your horse is really fit for the level of competition you need to be doing. I will confess I haven't incorporated that into my practice as well as I'd like, but there's leading science that's pushing us in that direction, and we should try and get over some of the inertia about trying it and getting more comfortable with it to help. I will just add a comment that I've had, been lucky enough to be around some of those athletes and their horse combinations that you mentioned, Jesse. And one thing that does stand out is how much those riders love their horses and the bond between those individuals. And just watching them, like you mentioned, whether it's out moving cattle or just going out for extra hand walks in even if you're in the World Cup and you can't get outside, just spending time with their horses is something that you see. And if it's not maybe the athlete, it's the groom. There are dedicated people that are supporting these animals, and I think that bond carries these horses a long way.
I would completely agree. I think anybody who really knows and loves horses knows exactly what you're talking about. And those writers, it's not just a job to them. I mean, they're famous for a reason. They're amazing, but they really do love their horses, and it shows in their success. Dr. Durham, final word, sir?
Wow. I think everyone's covered things so well. I I think the overall key message is really that we just need to pay attention to all the little details that if we just cookbook it, we're gonna be okay. But if we want a horse to really thrive in terms of their athletic ability, in terms of their longevity, we need to pay closer attention. That little things add up, and that both in the negative and the positive. Uh, in terms of farriery, I talked to a farrier who said once he started working on endurance horses, he really understood the magnitude of what a subtle medial to lateral imbalance could do, because the number of cycles that shoe undergoes, he just pictured, okay, I had a medial to lateral imbalance that horse had to handle thousands of times. And if I had the horse balanced, it wouldn't have had to deal with that. That's sort of an extreme repetitive example, but I think for any athlete, those little details really start to add up. That horses want to do their job. They're good at pleasing us, right? They'll do their job with bad shoeing. They'll do their job with bad nutrition. They'll do their job with without attention to all of these things, but not as well and not for as long. They're much more likely to be injured if we don't take each of those things really seriously.
And there you have it, ladies and gentlemen, a top to bottom look at how some of the finest veterinarians in the business are approaching your horses as athletes and building roadmaps to create competitors with longevity. So I want to thank Doctors Contino, Rosillo, and Durham for being with me today and lending their knowledge. So thanks to you all very much.
Thanks. This was fun.
Thank you.
Thanks, everyone. It was a great pleasure to be here today.
Absolutely. And to all of you listening, thank you for learning alongside me. So I hope you join me on the next episode. I'm Jessie Bengoa, and until then, take care all.